So this is the first day of our 5-part video sequence on Back Care Awareness Week and what you should be doing. And in this video, I'm going to go through those first few hours today or so when you've injured your back or you've tweaked your back. Now, the first point of call is that sometimes people injure themselves doing something like, oh, my back went a bit funny there, but I'm okay. And it's not till the next day that they injure themselves, wake up in the morning feeling terrible. So at that point where you think, oh, I've done something abnormal, maybe I made the bed for the little one, or maybe you've done a bit of gardening, for example, and you don't feel 100%, something wasn't quite right. Get on with ice down on this lower back area. You might have felt a little bit of a tweak, but it's not too bad. Use ice here, 5 minutes or so, 2 or 3 times later that afternoon, as soon as you finish what you're doing, if it was in the garden or lifting at work. Make sure you get that ice on this back. 5 minutes, and repeat that a couple of times a day. That's the number one thing. Now, number 2, you might be tempted to use heat in this area because that helps with muscle spasm. Now you've got to remember, this is not a good idea for things like back injuries. If you take this back like an ankle, you've just injured some of the ligaments or tendons around this region. If it's bending down to move a small plant pot and you've just been moving in an inappropriate manner, you haven't overstrained the muscle, you've injured the joint. And that joint needs to be what's treated rather than the muscle spasm that's making you worse. So using a bit of ice over this area is important. Using heat will further drive more circulation to this area and invariably mean that tomorrow morning you don't feel so good, in spite of heat feeling pleasant at the time. Now if you're getting any tension in your hamstrings, for example, or in your glutes away from the spine, then heat there can actually help those muscles. But putting heat straight over this section of the back is not a good idea. The next thing you should do when you've done that, you've injured your back, say it was in the garden or at work, little bits of movement. We've already mentioned the ice over here, then small amounts of movement, whether it's just walking around the house or something like that, keeping yourself in a nice upright position so you're not furthering any mechanical load. And that brings me to the next point, bending. Invariably, or most of the patients that come into the clinic here, have injured some form of weight-bearing structures, whether it's the discs or the facet joints. But commonly there's some involvement of forward bending and twisting that set this off, and that's going to strain the discs. When you've got that initial reaction to that first injury in the back, forward bending and anything that involves forward bending is not a good idea, because as you lean forwards like that, it increases the mechanical compression on that lower back and those lower discs, and will make the problem worse. So try your best to stay upright as best you can, brace your core to make sure you don't put any increased pressure on your lower back, and that applies to getting out of chairs, getting out of bed. Make sure you try and keep yourself as upright as possible and bend with the knees rather than bend with your back, and that'll help reduce further injury. The last thing is just making sure that you're not doing any sort of excessive twisting motions or anything like that, because those can also give you a little bit more trouble, especially if you do those after the icing. Remember that the icing is reducing inflammation, but your muscles down here will be a little bit stiff. So in the couple of minutes after that icing, make sure you just do normal movement, just walking around the house, no extreme twisting or anything, or bending forwards for that matter. And if you do those things correctly, you should limit the reaction that your body's going to have over the next 24 to 48 hours and mean ultimately a much faster recovery for that sort of minor back strain. So I hope this video has been helpful, and make sure that you stay tuned tomorrow for the next video in terms of what simple exercises you should be doing when the back pain's lasting a few more days than you'd like. Thanks for watching.